Why, hello there, Alison McQuinn.
Hello, Jeff Cornter. How are you?
I'm good. Thank you so much. It's so good to see you.
So good to see you too.
So enough silliness. Obviously, we know we didn't accidentally just bump into each other here. We planned it all out. But why we're here today is we've been doing periodically, those of you who've been following with our live streams, we've been presenting a series of different Heilkunst topics, health topics. And today, actually, we have a special guest. We'll just be bringing her in a moment, but we're really excited because we get to do, well, I know it's my favorite thing, and I think it is yours too, Alison, is really kind of find that meeting point between the philosophical principles of Heilkunst and how that actually appears in the world, like, how that actually makes a difference in the real world, right? Where the rubber meets the road, as they say. So as I say, we're going to have a guest. I'm going to be bringing her in just a moment. She's kind of in the green room, having some hors d'oeuvres right now, but we're going to bring her out to front stage. And let me see, where's the button here? So, hi, Nina, are you hearing us?
Yes. Hi, Jeff. Hi, Alison.
Hello. Well, welcome to our session today. As I just gave a brief little introduction a moment ago, we're going to be getting into the philosophical principles of Heilkunst medicine. But as I think we really like to do is not just leave it as abstract principles, but really make it clear and understandable and practical. Like, what does this have to do with anyone's life and their health, and how do we actually use these things? So we definitely want to end up there. But yeah, we have a nice little sketched out of some of the basic concepts. I have my notes. I may or may not put them on screen. I don't know that would really be helpful. I think more just us talking is the most helpful part. So that's a little bit where we're starting, where we're going today. Now, Nina, I can jump right into defining Heilkunst and so on, but do you want to say a few words of introduction, either about yourself or what kind of, the big idea you really want to grapple with today, or the big question you kind of really want to chew through?
Sure. So I'm Nina Halbert, and I live in Lincoln, Nebraska, and I grew up with homeopathy, and so I reached out to you mainly because I have questions. I know you have a broader approach, more comprehensive. I feel like I'm kind of piecemealing it from different directions, and I just know homeopathy has worked for us. I know you're good at what you do. So, but I kind of want to know the difference between the two with classical homeopathy, and then what you practice, what that looks like. I feel in obviously America, we have a bit more limited access to this approach. And so I love that you're accessible. This is amazing. So.
Mm-hmm. Okay, no, thank you. Yeah, that gives me a really good orientation, and we will definitely, I expect you will have a very clear answer to that question by the time we're done. If not, just put up your hand and say, excuse me, Mr. Teacher, I didn't understand what you were saying. But, yeah. And likewise, actually, for anyone who is with us live on our Facebook page or our YouTube page, you can participate. You can put in your questions, just the way you comment, on your Facebook page or whatever. Just add the comment, and we will see that here. And at the right time in our conversation, we can bring your comment in and speak to it directly. So that's as I say, it's kind of open to anyone who wants to participate along with us. So I apologize. This is a very technical event. You have to manage screens and buttons, and it's more than just people having a conversation. We have to please the computers as well. So, okay. So let's start. Just looking at my notes here. So let's start with the very word Heilkunst, and it's and actually that was one of your original questions when we were emailing, is how do you pronounce that, which is a good question. There's not too many German speakers around the world other than in Germany and a few odd places here and there, but yes, it is a German word. And Dr. Samuel Hahnemann, who founded the whole system of Heilkunst and homeopathy, of course, which is where his fame follows him. People think of him as the creator of homeopathy, but that's just one small part of Heilkunst. So yes, he was German. He wrote in German. This word is German, Heilkunst, and that's the origin of that. And he lived in the 18th and 19th century. sorry, the 17th and, I always get that mixed up, 17th and 18th century. No, the 18th and 19th. The 18th, he lived from 1755 to 1843. That's the 18th and 19th. I always get that mixed up, which how you say the century. So yeah, that word Heilkunst, and Alison will speak to this in a moment. It's a very interesting word because it's if anyone who knows more than one language, if you know, we all speak English here, obviously, but if anyone knows French or German or Italian or some second language, you know that it's not always an exact translation from one language to the other. Like where there's one word over here in this language, there's like maybe two words in this other language that, you have kind of a different way of saying that. And so anyways, why I'm saying that is we're going to talk a little bit about that with Heilkunst. We don't have an exact match to English when you break that word down. So what you really have in Heilkunst, it's a compound word. In German, heilen is the verb. Well, it's let me leave it at that. It's a verb, and then Kunst is a noun. So we'll explain what those are in a minute. But in English, you don't have exact translations, so we have to approximate a little bit. So, Alison, do you want to talk a little bit about the English equivalents of heilen and Kunst? Like what's all in that German word?
Yep, for sure. So heilen really literally means art, or really science as it should be. And it means that those concepts should never be split. You know how our children go to school and they have to choose an arts program or a science program? Well, in Hahnemann's world, this is not a good idea, and this really came to bear during the Romantic period, which is the time in which he lived from 1755. And this really was the opportunity in history to join us back into nature. So the Kunst part is really the aspect of healing and curing disease, right? As in a literal sense, to be able to affect cure logically based on principle each and every time without exception. And so it's the whole art of and science of healing and curing. And that is literally what it means.
Okay. Exactly. Thank you. So yeah, it's fun. That word is, as I said, is a compound word, Heilkunst, and then within that we get further unfolding. So yeah, we have the art and science, as Alison said, of healing and curing. So there's kind of like, it's almost like I see like a compass. The north, south, and the east, west. We kind of get these two interacting dimensions just in that one word. So there we go. You didn't know you were getting a full language lesson, but that's a great start.
I would have liked, even on your website, you had like the breakdown of diagnosis. And
yes, that's a really great word as well. Maybe we'll talk a little bit about diagnosis too. Actually, I know we will. We will be talking about that.
I like that history, and I'm wondering just how it's almost like coming back to there are different ways of practicing this throughout the world, but it's like coming back to what we've been given already in nature and using what we have. Also listening to your body, and I know we'll get into that, where we're not just treating the symptoms and putting out little fires here and there, but really he looked at what is creating the disorder, what's the underlying issue, what's the root cause, so we're not just treating the symptoms, but rather the root cause. So very smart.
And just as a little bit of a foreshadowing, as we say, one of our big questions that we'll come to is, how do you explain the difference between classical homeopathy and this broader system of Heilkunst? And just hold that in the back of your mind, this difference between healing and curing. We're going to see that difference has kind of been smushed together, like in classical homeopathy. That clear distinction has kind of been lost, and we'll see the consequences of that when we describe that. So as you just said, coming back to nature and understanding the principles and everything. Yes, that's the true job of the scientist and the physician and everything, is not to not to tell nature what it's supposed to be and how to behave, but we really need to be kind of in partnership with nature. Yes, we need to, just like in any marriage or partnership, we need to kind of come to an equitable understanding and kind of helping each other rather than one person kind of dominating the other and bossing them around or whatever. Well, that's, as you may guess, that I'm hinting at, in Western medicine or allopathic medicine, that's more the approach they take. They kind of try to boss nature around. And spoiler alert, it doesn't really end up well, because if you try to, blast people with chemical drugs and do all these things, you think you're going to get a good result, but nature always reasserts her power sooner or later and kind of does what she really was trying to do all along. So yeah, that approach is not how we want to do medicine or science, but yeah, more of this, as you were saying, this kind of coming to understand nature and properly work with her. So blah, blah, blah. Why I'm saying all this is when we're going to see in the classical homeopathy, there's a bit of a failure as far as coming to that proper understanding, like even from the very basics, the very beginning. What is this difference between healing and curing? Well, if you're not clear about that, you're gonna see consequences as you keep going down the line with that.
Sure.
Mm-hmm. Okay, so very nice. So, oh yeah, so I have a little bit of a bit of show and tell here. I'm going to share my screen for a second here. There it is. Okay, this is, I'm sure we've all seen this someplace or other. This is actually a famous drawing by Da Vinci called Vitruvian Man. And as you can see, it's kind of a peculiar image in a way. It's actually not, in a sense, not one man. It's kind of two superimposed on each other, like a four-legged, four-armed man. It's like, well, that's kind of a funny mythological creature almost. But why I'm putting this picture up on the screen is I think it's a great visual representation of really understanding Heilkunst in this broader system, is that everything that we understand about the human being in relation to nature, all the different principles, the human being and their physiology, everything about us and nature is kind of has a dual nature, right? So as I say, this funny drawing of the four-armed, four-legged man is not so funny when you really understand human physiology. We are kind of that creature, each one of us. So let me just take this back off my screen, get our nice faces back up again. So just for example, to this understanding this principle of duality, this nice conversation that we're having here, we see these three smiling faces here on the screen. In a sense, we can say there are six beings participating in this conversation. Each one of us is contributing a dual human being to the conversation. So I know that sounds like a little bit of an out there concept, but let's just run with that. Let's stick with that. Well, we'll run with our four legs and try not to trip. But yeah, that very basic principle of that duality of the human being, the more you delve into Heilkunst, you're going to see that runs everywhere throughout the way we practice medicine, the way we diagnose, there's our word again, the way we approach a whole treatment and all the rest of it. Alison, just off the top of your head, I'm sorry I didn't prepare you earlier, but what would you give an example or two of where duality shows up in the Heilkunst system?
Well, we talk quite a bit about the upper and lower man. So the upper being more the realm of anxiety, where the lower man is where the deeper fears, terrors, anger, guilt, shame, resentment, and it'll show up in the upper man really as trying to hypermanage everything, heightened sense of like greater heartbeats, sweating palms, fears, concern, unable to sleep. That's kind of a duality that I can think about. Parasympathetic and sympathetic. So we can have people that are what we call sympathetic storming. It's the same as your eyes open and then they close, spigots open to digest your food and then they close. Our whole body is based on these polarities. So the sympathetic Storming individual is, again, somebody who's extremely anxious, very stressed, and you're trying to get somebody to be more balanced between these two polarities. This is the autonomic nervous system I'm referring to.
Basal brain versus
Yeah, well said. The reptilian brain.
Yeah.
Okay.
And even actually going back to our original language lesson, that word Heilen, meaning healing and curing, again, a broader, deeper understanding of that would see that one of our beings is more in charge of governing, how the body heals, and the other being, as I'm saying, these two beings that's the one that's more involved with the processes of disease and cure. So we're going to see that again a little bit a few minutes when we get into some more of the specific treatment principles. But yeah, even that duality we could have said that right from our first language lesson on the Heilen and the Kunst, the Heilkunst. So yeah, the healing and the curing speaks also to that duality in the human physiology again.
I'm just wondering, in a way we can treat homeopathy in an allopathic way in that I have this symptom, so it will do the salt for this, where we're just, and so I sense that it did get the full picture. So when you bring together body, mind, spirit, whole person, is that kind of what you're communicating? Again, like this is a new concept for me, the way you're presenting it, but I'm wondering if that's how I've tried to pursue that with the brain being an organ there, or a common book, if I can go this direction, the common book that's being recommended right now, just in my different social circles, is The Body Keeps Score, where we see different ramifications of trauma in the brain and the spirit showing itself, having physical manifestations, and you're not just going to throw a remedy at it. There's more underlying there. And the spirit, the spiritual realm, where there are things so much there. Again, just the whole body, where you can't parse it out. And then so I'm going a lot of different directions, but I like where you talk about working together with the body, because you can put this on, snuff this out, put this on, snuff this out, but the body's really trying to communicate something that's going on that needs attention, that needs care, that needs, again, get to the root of whatever it is. And ideally, we identify these things before there are negative physical manifestations. And so, am I thinking the right thing?
Absolutely. And you're kind of heading the conversation back to that other key word that we floated by already, which is the word diagnosis. So as you put it, just because somebody comes up with such a symptom and you go and throw a homeopathic remedy or maybe a tissue sol at them, that may very well have been an allopathic action. Excuse me. That may be an allopathic prescription because that's that symptom and this remedy matches that symptom on the label. We haven't diagnosed it, gone through the full dimensionality of the human being and determined what is the actual problem, because a symptom is not the problem. A symptom is speaking from somewhere, but we have to find where that is to properly diagnose. And yeah, you've kind of alluded to all those different dimensions already. So yeah, I like how you've in a sense, you've brought us back around to that word diagnosis again.
In your practice, what does that look like when someone comes to you with an initial intake? What is the process there?
Yeah, it's a great question. So what we know about Heilkunst is that there are 3 jurisdictions. The first jurisdiction is regimen. And this is where Hahnemann started as well. He wanted to kind of eliminate, is it diet? Is it the fact they're not sleeping? Is it the fact they're living in a damp swamp? Is their biological realm really toxic? Are they taking drugs? Do they have a mouthful of mercury fillings? What have we got here? And so that's really where you want to start, is the process of detoxification, right? You want to make sure you kind of have a clean slate, right? So you know what you're shooting at. And diagnosis meaning through knowing, literally from the Greek. You need to know what it is you're seeing, because is it an issue with regards to a genetic miasm that's causing that lung infection, or is it because they're living in an area that has black mold in it? You want to know what's the cause. And then once you've resolved issues with regards to regimen, then you kind of get a second jurisdiction, access to the second jurisdiction, which is de-traumatizing and demiasming. And that means literally you are removing blocks and shocks and traumas in the order in which the body has assumed. Now, this is a big, big difference between Heilkunst and classical approach, is that classical is going to be treating, let's say, the bursitis in the elbow, but it's not going to actually get to the cause. It's going to throw a remedy that looks like it's the one remedy for the person.
Right.
Well, Hahnemann never said that. He said it's one remedy per disease. It was a mistranslation for the last 225 years. So that's a pretty important distinction. And a fellow by the name of Dr. Almaguer really said that disease is layered like an Italian wedding cake. And you actually have to peel that onion in the order in which it was assumed, meaning that you start by addressing the first trauma that is closest to the surface, and you work your way back to the patient's birth. After that, you have access to 8 genetic miasms, which are really the 8 chronic diseases that are constant to that person. And you will see that they are consistent, those diseases, in every single patient. They show up the same with with variations, which sounds odd. So cancer, for example, always is the disease of resignation. It is always the disease of rescuing others to the exclusion of self. It can show up in the stomach, right? But the state of mind is always the same.
Does this
So
coincide with like the scientific, where we look at like tumor necrosis factor, interleukin 5, like where you have, it is 3 separate, I would say, like tendencies, or your makeup, or do you feel it's trauma that influences that to influence what you're susceptible to? Are you born with that, or do you feel?
yeah, and it's a combination really of both. We all carry these 8 genetic miasms. It just means that often karmically we will spawn more symptoms for those particular a single genetic miasm more than another. And again, that has to do with our predisposition to our family, our not just the inherited aspects, but what kind of family matrix did we choose? What kind of traumas, what toxicity? But underlying all that is a resonance for that particular disease matrix. It's kind of like the contract we signed before we got here in this particular lifetime. And so, yeah, we will invite really those disease matrices are invitations for transcendence.
Right. Okay.
Yeah. And the third jurisdiction of Heilkunst medicine is more the spiritual aspect that you touched on just a few minutes ago. It really is to work with the patient,
I apologize for that.
which speaks to why did they engage with that disease matrix in the first place? So once you're dealing with diet, then de-traumatizing the person in order sequentially, and then working on the reasons why they engaged with that disease matrix in the first place, then you really have the opportunity to get a high cure rate up in the high 90s.
That makes sense. Just addressing the thought, the belief system that influence that. Do you feel your role is largely therapist then? Do you take a therapist role within?
Yeah, I love
this
that
type of
question. It's awesome. People will tell us that it's like coming to see a naturopath, an ND. It's also coming to see an MD because they have access to medicine, you know, curative principles of homeopathy or Heilkunst. And then you have the counseling aspect or the therapist aspect. So they'll say it's a one-stop shop, really.
And I'm gonna add a bit of a context or a framework here, which I think will kind of add a little more dimension to all these things we're saying. And let me see here. Yeah, this particular construct, like back to this question of diagnosis, back to how do we treat somebody, how do we look at a person, look at their case and everything. Ultimately, in the biggest framework, the biggest picture of Heilkunst, we have exactly and only 3 therapeutic jurisdictions. And I'm very I'm very definite about that. I can guarantee that none of us are going to wake up tomorrow and get our morning newspaper and see the headline, Heilkunst has discovered a 4th jurisdiction, breaking news. That will never happen because these 3 jurisdictions cover the entire spectrum of, the physiology of the human being, in health and in disease, what kind of therapeutic issues we need to consider, what kind of therapeutic approaches, every possible thing. And this isn't just Heilkunst, this is really the entirety of the whole healthcare system, every single modality, everything from surgery and massage and nutrition and, every modality you've ever known and every modality you have yet to find out about, they all will fit somewhere into those 3 jurisdictions. So I'm being very absolute about what I'm saying, but I have to because as I say, there will be no newspaper headline tomorrow or anytime announcing a 4th jurisdiction. It just won't happen. It can't happen. Now, that being me being so absolute about everything, let me get a little more detailed here. So let's define this. The therapeutic regimen, our kind of base jurisdiction, and Alison has already spoken to a number of examples here. The main issue in therapeutic regimen is imbalance. And we all know that word very well. We all talk about living a balanced lifestyle and having a balanced diet and so on and so forth. Did I get enough vitamin C in my diet and enough calcium and enough magnesium and enough of this? So it's what I like to call the Goldilocks. Is it Goldilocks and the 3 Bears? It's like, yeah, this porridge is too hot, this one is too cold, but this one is just right. Well, that is the principle of this first jurisdiction. Therapeutic regimen is, you have to be baby bear in every part of your life. You get just enough of this vitamin, that mineral, just the right kind of exercise in the right quantity, just the right amount of sleep. And we all know the problem. If you get too much of something or too little of something, you will get some kind of imbalance. So, and most people, they come to healthcare, they come to especially natural healthcare, and they put a whole lot of time and research and effort into this. And that's great. Like we need this jurisdiction every day of our life. Like you can't stop breathing and you can't stop eating healthy food and you can't, do all the things that your body needs just because you feel you got healthy and now you're just going to coast for the rest of your life. Well, that's kind of an everyday job, is keeping everything in balance. So I say most people start there. They learn a lot. They study a lot. Whatever. Of course, there's all kinds of websites and blogs and advice. And yeah, this jurisdiction is very, very vast, as all 3 of them are. But this is one of the general points about the jurisdictions, is we need to understand each one of them precisely on its own terms, but not to, this is where people go wrong in healthcare all the time, is this is kind of like the example we gave a few minutes ago, is someone may come up with a symptom and then you maybe give them a tissue salt, you give them a homeopathic remedy. But if you have not given a proper diagnosis, you don't know which one or 2 or 3 of those jurisdictions is that symptom coming from. If you just throw a remedy at it, I can tell you by definition, you're being an allopath. You're being allopathic, right? Because you don't have the diagnosis. And in this case, this biggest, the grand level of diagnosis, of defining diagnosis, you have to start with diagnosing even which jurisdiction are you looking at in the first place. And then and sometimes it's 2, sometimes it's 3 for a given issue or whatever. And then when you have the jurisdiction, then you can drill down into the precise diagnosis within that jurisdiction. So anyway, so here we are. We have the first jurisdiction, this what I call therapeutic regimen. It has the challenge or the health problem of imbalance. So of course we all want to be balanced. And the therapeutic principle, because each of the jurisdictions has a distinct principle, and here the principle is the law of opposites, right? So, back to my examples, if you don't have enough vitamin C, well, you solve the problem of a deficiency with temporarily supplying an excess. You give more vitamin C than the person would normally need. You kind of bring them back to that balance point again. If they have too much of something, you have to go the opposite direction. You have to tone down their intake. So again, it comes back to that point of balance, right? Again, very common sense, like we know what balancing means. We know how to balance something. But yeah, that's the precise way we define that principle, is the law of opposites. You have to do the opposite. Now, where we are usually familiar with the law of opposites in our modern healthcare world is most of allopathic medicine, Western medicine, in their medicine, not in their regimen, but in their medicine, they apply the law of opposites. And that's, as I say, if you apply the wrong principle from the wrong jurisdiction for the problem, you're going to get a poor result. So their opposites are things like antibiotics, antidepressants, antifungal, anti-whatever. That word anti means against, right? That's the law of opposites. So they're opposing everything, but they're in the wrong jurisdiction. So right. Just like, like
antacids.
Antacids.
Exactly. Yeah. Right.
Oh.
Right. Exactly. Mm-hmm. Yeah. So, and just like in like this whole word jurisdiction, of course, that comes from the legal realm, right? We talk about legal jurisdictions. There's criminal law and civil law and family court and traffic court, and all these different judges and courts waiting to see your case. But you have to take your case to the right court and the right judge. You can't just take your traffic ticket to family court or whatever. That's not the place to go. That judge is going to kick you out, send you down the hall, 3 doors to the left. They're going to send you to the right jurisdiction, because the judges know they're not allowed to act outside of their jurisdiction. And when it comes to healthcare, we should be as wise. If we're not, we are violating the laws of nature in that case. So those allopaths with their law of opposites in the wrong jurisdiction, the antacids, the antidepressants, and all the rest, they are not curing disease, they are suppressing it. Now, temporarily, sometimes you need to suppress, but long-term, no. If you just stay on the suppression path, you're just going to deteriorate that person's health, and not cure their disease, not cure their problem, and things are just going to get worse and worse over time because you're not matching the right principle to the right jurisdiction to the right problem. So anyway, so here that's a little bit broad, and here we are in the first jurisdiction. So who would like to hear about jurisdiction number 2? So I just mentioned the allopaths. Oops, I can't click there. I have to switch my screen. Okay, jurisdiction number 2. Now I mentioned the allopaths giving their medicines, but they're doing it wrong most of the time. They're giving medicines on the law of opposites. What you want to do when it's time to give medicine is give it on the law of similars, and that's certainly, if you have any exposure to homeopathy, even classical homeopathy, you will have definitely heard of like cures like and the law of similars, and and all these kinds of phrases. And that is precisely the right time to use medicine, is when you're using it in this law of similars way. So homeopathy is the true medicine that nature really intended for us to be using for curing disease in this middle jurisdiction. So I cut you off. You were about to say something?
Oh, I was just affirming the like cures like.
Mm-hmm. Yeah. So there you go. So in the right jurisdiction at the right time, and and we've seen this. Many people have seen this. the correct homeopathic remedy given is like magic. I mean, it's science, but to someone who doesn't really understand the principles, you may as well have done a magic trick because, how did you do that? It was like, my baby was teething and crying its head off and screaming, and its face was red, and it was having a miserable time. And I just gave it this one little dose of chamomilla, and 20 seconds later, she fell asleep. Well, how do you explain that? Well, that's just the laws of nature. They work quite well, but as I say, if you go the allopathic route and you give an allopathic drug for that, a painkiller or something like that, yes, maybe the baby will stop crying, but then 2 hours, 4 hours, 6 hours later, or so on, when the drug dosage are wearing off, the baby will start screaming again. The pain will all come back, but slightly worse than it was before. So this is the unfortunate thing about allopathic medicine, is you have to keep repeating the dose over and over and over again, and then stronger and stronger and stronger.
Other problems.
Yeah.
Yes. It just compounded it.
Exactly. So yeah, and this is a very unfortunate illusion for the patient and the doctor alike. They think a good thing is happening when that dose is being given, and okay, that calmed down the pain. Okay, we can all get some sleep now. But yeah, it's just compounding. That's the perfect word, and it's as I say, it's a great illusion, and it's an illusion that the more people we can break out of, the better off everyone will be. But so there we go. So two jurisdictions down. Actually, before we move on, any kind of clarifying questions on either law of opposites or law of similars?
That's clear.
Mm-hmm. Yeah, Nelson, you've heard of all this before, right? No surprises here.
Seems a bit familiar.
Mm-hmm. Yeah, no, I'm always afraid one day you're gonna say, no, I only use 2 jurisdictions. I don't know what you're talking about.
I might be. I'm curious to know where I'm stuck. How many years have you been doing this, and how long have you worked together?
Yeah, well, actually, that's a good question. So in a few months, in June, will be the 20th anniversary of when I started formally doing this, like as a like a professional clinic and everything. I was studying before that, so 20 years plus however many years of study before that.
Yeah, and I'm 18 years of skin in the game.
Okay.
Mm-hmm.
Wondering. Thank you.
Mm-hmm. And yeah, and so that other question, yeah, Allison and I have been at least studying together for all of those 20 years, if not slightly more. So.
Mm-hmm.
Mm-hmm. Yeah, so that's why if I'm making really goofy jokes and teasing her or whatever, it's just because we know each other a little too well, and we can kind of finish each other's sentences, although we still do surprise each other sometimes. But. Mm-hmm. Okay, jurisdiction number 3. Any guesses? But not you, Allison. You already know. But what do you think we're going to find in the 3rd jurisdiction, Nina?
I'm really curious. I'm serious. I really am curious. Are you empowering the patient? Are you is this part of the discovery and then equipping them?
Partially, yeah. Yeah. Okay. I'm sorry. I shouldn't tease you so much and keep you in suspense. So
tell me.
So therapeutic education, where therapeutic regimen was dealing with imbalances, medicine is dealing with disease. Ignorance is its own separate 3rd jurisdiction, and that's where instead of law of opposites or law of similars, here we're dealing with the law of truth. Now, that's almost a little bit of a loaded term. It's like, okay, well, what do you mean truth? Like, whose truth? Your truth? The guy down the street? Like, whose truth are we talking? I know that's kind of a loaded term, but in a scientific sense, there are truths, right? Like, even right here, the law of similars is a truth. Like, that's a law of nature. I didn't invent it. I didn't pretend I saw that in nature. Like that's been observed and verified in nature.
Like the law of
many
gravity.
times over. The law of gravity. Yeah, we didn't just decide we wanted to invent a law of gravity just because it was nice to have something to talk about. But it's a very true thing. So yeah, there is such a thing as truth. Now, of course, human beings can often be in error. I know in my case, many times a day for sure. But that doesn't change the fact that there are truths, and either you are following those laws of nature, intentionally or accidentally, or you're breaking those laws of nature, again, either intentionally or accidentally. So again, in the most general sense, we don't have to be too worried about this word truth. It is a real thing. And again, this is the whole scientific process. But in the therapeutic process, it means like a number of different things, right? So you've kind of touched on it a little bit already, what you just said a moment ago. And Alison, I know you were talking about some things earlier, you were touching on it as well, but just all that to say is it's kind of a all the jurisdictions are multifaceted, and this one is no exception. So yeah, this whole business of ignorance and truth and the law of truth and therapeutic education. Well, actually, let's pause on that word even for a moment. Here's a really good concept and a word, education. And actually, Alison, you have many things to say. Education, that's one of your most recent books, is called Self-Education for Excellence. It's one of your great important topics in your life. But yeah, to keep in our therapeutic context for the moment, the word education is well, the etymology of it, I guess, comes like, if you break it down, the word educe is kind of like this idea of that you're pulling something out of somebody. Like if you're a good teacher, a grade 3 teacher, a guitar teacher, a piano teacher, any kind of teacher, the best teachers are the ones who really help the student to get rid of all the blockages they have in themselves, so they can access that primal human knowledge that we all have somewhere deep down inside of us. We've just forgotten. So when we call somebody a know-it-all, that's that we can kind of be teasing somebody, whatever. Oh, you're just a know-it-all or whatever. But fundamentally, deep down, each human being really does know it all. We've just kind of forgotten it all. So when we have a good teacher, they're not one who just kind of repeats things and makes the student memorize a bunch of stuff, but they're the one who can kind of really help that student get out of the way all those blockages in themselves, which are kind of blocking their access to that, as I say, that deep universal knowledge that we all have. So, for example, when we talk about the law of similars being a universal principle of nature, well, all the universal principles can be uncovered by every human being. We have access to all of that. So, anyways, I'm just kind of defining this word education, but it just, for the reason, it gives us a clue as to what even is the beginning of this third jurisdiction. It's really about, in multiple different ways, bringing out the deepest truth of every human being. Like, yes, we have universal truths, the law of gravity, the law of similars, all these things we can all come to agree on scientifically, but individually, we each have a very unique truth. We each have a very special talent, a very special kind of idea or concept or even ability that we are, like the way some people are talented, in music or talented in art or this or that. We all have special talents that we're meant to uniquely bring into the world in our own special way. So that's part of education in this specific therapeutic sense. The ultimate journey for every patient, if, as they say in Star Trek, if, the what is that catchphrase? What's that phrase about the journey where no man's gone before, or something like that, the final frontier. So anyways, each one of us individually, we are kind of our own final frontier to really draw out and pull out that very unique, special individual talents and individual truths that we have to to show to the world and teach to other people. So as I say, I use music, art, whatever, as an example. But yeah, we each have some very special purposes to bring to the world. So yeah.
There's some really hard work there when you talk about this third principle, this third jurisdiction. How old do you typically find people to be when they're questioning this, when they're looking to find out, who am I, what am I about? Is there a certain age that you see that a pattern? Or like ready to do the hard work?
Don't know that there's a very consistent pattern. I mean, there's all different reasons people, it's like, look at a garden of tulips or whatever, and they may each kind of bloom at different times, because one is closer into the sunlight or whatever, the conditions are different. But yeah, people kind of bloom when they're ready to bloom. Yeah.
Yeah, and I think we're all asking questions at different stages in our lives that lead to that same desire to unearth, who we are, what we are, what's my purpose, what is my function here. I just served a young lad, he's 15 last week, and he's asking these hard questions, and so, but I've worked with individuals who are in their 70s and 80s that are asking these questions now. So, yeah, it kind of depends when the person just feels almost like when you maybe remember people that are called to the ministry. So, somebody who, is called to the priesthood. We all get a calling really to unearth our divine or essential selves during the course of our lives. It just seems to be that calling is at different times in people's lives than in others.
And from a Heilkunst, like a medical perspective, a Heilkunst perspective, like obviously if somebody shows up ready and they're really specifically pursuing those kinds of questions for themselves, obviously we follow them there, but by and large we don't push anyone there. Like we just kind of follow the logical process of Heilkunst, work our way through the visible things we can do in the three jurisdictions as they apply to them, and as we remove those blockages, the person just more and more comes to whatever their natural rhythm in life is. If they're meant to, blossom into those bigger questions at age 20, at age 50, at age whatever, they will do that. But yeah, our key from the therapeutic perspective is just to do our job, make sure there's no obvious blockages that are sitting there in their system that don't need to be there, basically. So yeah, the more you systematically and logically address those, the more they just come to, as I said, whatever their natural blossoming rhythm is in their life,
Mm-hmm.
Probably have to pay attention to, well, obviously you're tapping into like what is their upbringing, what are their core, most deeply held beliefs, who is their identity. Like for us as Christians, is like, who am I created to be in Christ, and what is getting in the way? What fallacies are there that I need to? Where did these come from? How do I address these? How do I reframe? And what does that look like lived out in real life?
Yes.
I apply that. And so it's nice to have somebody who has that understanding to guide in truth, just in understanding self and what's a better way of doing things.
Mm-hmm.
So if that makes sense.
Mm-hmm. That's a good way of putting it too. Yeah.
Yeah, it is amazing for us. It's an honor to watch it when you unblock shocks and traumas during the course of someone's life, or remove those genetic miasms, and you really see them get that calling. It's like their divine function. It's an ember before, but you turn it into flames, that start to really lick the inside of their spirit. And you get to see all of a sudden, they're teaching themselves guitar. They find a job that they just really love, or they quit the old job and start a business, and they have the confidence they never had before, or they find their beloved resonant partner. That often happens through Heilkunst treatment. It's so cool to get that call mid-month when the patient goes, "Oh my gosh, I found him. You won't even believe it."
Sure.
We work on, that aspect of what part of ourselves lost our inner value through the disease matrix. How was our inner value eroded? Because like you said, under the dominion of God, we all have this beautiful inherent worth and functional purpose, but disease occludes it, covers it up, so that we don't get a clear sense of what that is anymore.
Mm-hmm. Mm-hmm. Yeah, the therapeutics part of all that, as we're kind of saying in different ways, is just kind of getting all the stuff out of the way that doesn't strictly belong as part of that person, so that their true self can more and more be what it is and express itself in the world in all various ways. Yeah.
Mm-hmm.
Of course, that means in very, the usual way people talk about health, your physical functions and, your, your pulse and your heart rate and your, all the physical things are doing things right, correctly. There's no physical symptom. All the usual things people often start coming to us for is all those physical symptoms, the typical medical conditions that people get labels for. But yeah, ultimately, the more you relieve those things, the more they, at their own pace, sooner or later, start to come to these bigger questions. But I say we never force them down that track, but it's just, nature takes its own course sooner or later once you go in that direction.
Yeah. In the beginning of Heilkunst treatment, I always say there's a lot of turbulence. It's actually difficult. You're flying, your instruments are giving you different readings. Like Jeff says, you're not always sure which jurisdiction you need to apply, because you're not always sure in the very beginning where the issues are coming from. But you get there always. Within 4 to 6 months, you have a very clear flight plan now. And there's no ambiguity. You're not guessing anymore. Oh, maybe this supplement, or once you have them on that track, it's like all the instruments start to line up, and they're flying straight. Every month when you're peeling that next layer off their onion, you have a really clear sense of where they've been and where they are and where they're going. And it's a thing of beauty to behold. It really is. And as Hahnemann said, he said, God endowed us with the capacity to cure disease. And he did it in a way that there's no toxicity, there's no side effects. There is the capacity to actually resolve things outright without, tinkering with a million different supplements or tinkering with a whole mess of drugs, because both have side effects and don't hand the reins over completely to the patient, which is, of course, the goal of health, is to enable them to have their full functioning power, not just on the physical level, but mental, emotional, and spiritual as well.
And what I'm just thinking of at the moment, I think we've kind of come to a good place to go back to that one of the original questions on the difference between Heilkunst and classical homeopathy. And now that we have this 3 jurisdiction framework, I think you can almost give the answer for me to a certain degree. Is the whole what kind of developed in the whole classical approach? Alison mentioned mistranslation earlier. There's a lot of translation issues. There were other political issues. There is in, I guess, almost every field, like political factions break apart and go in different directions. But the bottom line is the whole classical approach has devolved into this really the one jurisdiction, the middle one, the law of similars and medicine. But even at that, they don't even do the full jurisdiction of medicine. They've even reduced that down to like one part of the law of similars, but they've ignored this whole other important part. And I'll just very briefly explain what I mean by that. Is there's the part of the law of similars which very directly treats immediate symptom pictures. A few minutes ago I gave that example of the teething child and the I don't even know, did I say chamomilla?
Yeah, you did.
Oh, did I? Yeah, and so that's the law of similars based on symptoms, and that's valid. That's perfectly good. But then there's a whole other dimension, and I would say much more important in the long run, of what we call tonic prescribing. That's just a technical word. And that really gets more to the underlying cause, the underlying diseases, which may or may not have any symptoms expressing. So people, just because somebody is wandering around without any symptoms, it doesn't mean that there are no diseases in their system, right? So that's that whole other side of the law of similars has been completely cut off by classical homeopathy. So they've just, they've narrowed down from 3 jurisdictions to 1, and then in that one, they've even narrowed down to just one part of the jurisdiction. So you can imagine if you cut out all the rest of it, that's where the efficacy in classical homeopathy is so low, because yes, when they hit like that chamomilla baby with the teething, they're going to hit those, they're going to get those successes, but so much more of chronic disease, it's a very bad hit and miss kind of circus show that you don't really want to get caught up in.
Mm-hmm.
I have seen it arrest significant, genetic conditions,
Hmm.
um, you know, preventing surgeries and pills, like a life of
Yeah.
pills. But I've also seen where you have to keep coming back for it, and then there are bigger underlying issues, and those start
Yes.
popping up even later on in life. Like, oh my, there was more to this. And I find that as we talk about those three disciplines, I wish I'd taken a screenshot of that, what you had pulled up.
You want to
I
put
can
it
put that
back
back
up,
up.
honey?
Yeah. Let me find that again.
The first
Uh,
one, keeping you at more of a holistic lifestyle where you're um, eliminating. Well, okay. There are a couple of questions I have within this, actually. I wanted to know, do you start at a certain baseline as far as, do you order labs? Do you read labs? Do you have a general baseline? This is where we're going to start to support your body. And I know that's right at the therapeutic regimen, but do you start there or yeah?
in some cases, yeah, we'll draw on testing and so on. Um, and when I say some cases, I mean more when there's more extreme imbalances, more extreme health issues. Yeah, you need to kind of bring in the like bigger kind of diagnostic tools. Again, diagnostic, I'm putting in air quotes because we have a broader definition of diagnosis here. But yeah, for the majority of people, just following the basic principles, the basic sequences, the regimen, the homeopathic medicine, some of the therapeutic education as things come up and so on. Just by following along the basics, you don't need a whole lot of, like a complex stage show or whatever. You don't need a big, song and dance and light show or whatever, like all these complex things. Just by following the basics, most people, like the majority of people, will move fairly quickly, like along that path of health. But yeah, to your question, like, yeah, we can use those and sometimes will, but we don't automatically or always because it's overkill most of the time.
Yeah.
Okay.
And it's not that we need them. Often the patient needs them.
Right. We like to see it.
Yeah. So we'll send them for live blood analysis, for example, because, I have a patient right now who is diagnosed with 4-stage cancer. Well, I ask that she go for live blood analysis every 4 or 5 months so that she can actually see all the progress, so that she feels good about all the work that she's doing and that she can actually see those results. But we've been doing this for so long, I guess, that when people bring us the hair analysis, the live blood analysis, even the allopathic reports, yes, we're trained to read them. Do we need them? Not so much. Just again, because as Jeff says, when we start following those 3 jurisdictions as early on as the first month or two, things start to fly straight, the instruments straighten out, and you don't have the complications that you're using that you would normally see in other cases in other systems. So Jeff also uses something called core bioresonance feedback, which is a direct reading of that person's really their life force. Will show even what vitamins they're short on, and we can do this by distance, which sounds pretty crazy, but we have for almost 12, 15 years now been able to do readings by distance. And that actually is like an oracle. It really speaks to where that person is with regards to anything that you want to search on. So whether it's issues with regimen, where they have a shortfall in their diet or their supplementation, for example, it will actually tell you exactly. Also tell you which traumas are left to be treated. Also will tell you which genetic miasms are the most prevalent for that person. It will also speak to where their delusions are, where mentally, emotionally there are schisms. So more, and Jeff was my therapeutic or my supervisor through my clinical supervisor. And so more advanced patients with more advanced pathology will end up typically having core done with him. So this is our very advanced system to be able to diagnosed to, the letter. And again, we don't always or typically need that, but patients love to look under the manifold to see what it is that's going on under decks. That because it's know thyself. In the Bible, that is one of the clearest tenets, is that you get the opportunity to really see and unpack the essence of who you are.
So we've certainly covered a lot of good ground. I know there's always more depth, detail questions, and we're certainly happy. And same for our live viewing audience. If you want to put any of your questions right into the Facebook comment box, under this stream, we will see that pop up right here. But yeah, so to bring it back home, like we started, the big questions, what's the difference between Heilkunst and classical homeopathy, and some of the bigger questions about how we work. So I know we've covered a lot of the basic orientation around all that. So what if anything is kind of left over for you, or kind of sitting there, kind of unanswered, or you're confused or unclear?
I'm glad for the flyover view, because it's hard to grasp into some of the writing, so I was glad to discuss with you. This is helpful. Again, some of these are new thoughts to me. I'm kind of thinking through, okay, what do I think of that? And I thought I was kind of pushing the envelope on some things. And so I'm used to machines doing the readings. I'm used to doing different titrations for something. I mean, there's just a different approach. So I'm happy to learn new things, and thanks for breaking that down.
Such a pleasure. I remember my post-grad supervisor. He said to me, "Ali, I want you to go and pretend that you have no access to remedies, no access to your diagnostic tools. Al, I want you to tell me and explain to me in detail how you are going to treat that patient."
Well, we know so much about healing happening in relationships. And so there's something I recognize you focus on that. And that's seeing that person as a whole person, body, mind, spirit, emotion, all of that. And
yeah, and so are you. And so are you. And so are you, all of that, right? And so to be able to mirror that individual and to participate them so deeply on their terms that you become the homeopathic remedy.
I think that's interesting. We do encourage one another. We do meet one another's needs. We do. I'm trying to think.
Yeah, I know. And mostly, like, encouragement is the law of opposites, if you think about it. Encouragement is the law of opposites. And so it's actually very interesting when you start to, and I think more and more medicine is coming to this place that we are ready really to fulfill our full endowment. And that means less pulling, levers like the Wizard of Oz behind the scenes, and getting more into the essence of what does it mean to be a true physician, the knowledge of the physis.
Thank you, Allison. Jeff?
You're very welcome.
No, it's with my pleasure.
I pressed a button
Thank
by
you
accident.
so much for participating, Nina.
Means a lot.
Yeah, thank you so much for taking the time
share and answer questions.
Such our pleasure. Thank you so much.
Okay.
Yeah,
well,
and thanks to all our participants. We really appreciate you coming out and spending time with us. And Elaine, we love you too. Thank you for making your comments. Mac, thank you so much for coming out.
Okay, well, we'll see you all. We don't have a scheduled one, but we will be back. We like doing these live streams. And yeah, I thank you all again, and we will see you when we see you.